Hi, this is Dr. Yadzana Omer, an internal medicine trainee currently working in the NHS. And this is 5 reasons why I think you should become a doctor. When I was in high school, not sure what I'm going to do with the rest of my life, medicine was definitely one of the options that I was thinking of, but it wasn't the only option, and I wasn't sure I was going to spend the rest of my life being a doctor. My brother, who was then in medical school, gave me some really good advice. He said, listen, if you have a general interest in medicine, you will find something that you like. And this is my first point. There's a wide range of jobs in medicine, from a doctor doing autopsies in the morgue to a pathologist looking at specimens, trying to diagnose a type of cancer under a microscope, to a neurosurgeon doing brain surgery, to a psychiatrist or a neurologist or a dermatologist seeing patients in clinic. There's a wide range of jobs, and if you have a general interest in medicine, you will find some niche that you are interested in. Now, not only is there a wide range of jobs, but there's job security as well. That's my second point. I know hundreds of doctors from different countries, and I don't know one that doesn't have a job. And that's partly due to the nature of the job, that you're helping people. We always need doctors to take care of us, to tend to our sick. And not only do you have a job, but your opportunities to work and study in different countries also comes as a bonus when you work in medicine. My personal experience, I'm Kurdish, and I was born and raised in the Kurdistan region in Iraq. But because I wanted a better training, I pursued training in the UK, and it was my job that allowed me to find a job easily, and that's another benefit of working as a doctor. Now, all these are great, but the main reason why I think you should become a doctor is to help people. Now, doctors save lives. I know that a lot of people use that in their medical school interviews, and some of you might think it's naive or it's cliche that you think that, oh, you're going to be a doctor to save lives, but it's at the core of medicine. It's at the core of being a good doctor, caring for patients, saving lives, and improving your patient's quality of life. If you work long enough as a doctor, you will save a life, and that will give you immense satisfaction. It's a service that you provide for humanity as a whole, and it's not just saving lives as you see on TV. It's also helping people with chronic conditions, with debilitating symptoms of pain and chronic medical disease that you can help prevent and control with your knowledge and expertise. So if you're an altruistic person, if you're philanthropic, then this field is for you, and it will give you immense satisfaction. You're doing your job, you're getting paid for it, and you're making a difference. Now, this brings me to my fourth point, which is medicine feeds your intellectual curiosity. If you're into cutting-edge research, if you're into problem solving, then medicine is for you. I'm in internal medicine at the moment, and I'm thinking of doing neurology as a specialty. And to me, that part of medicine is beautiful because it allows you to look at a patient, to examine them, to listen to their problems, and to run some investigations and tests, and you can come to a diagnosis. You can figure out what's wrong with this person without having to necessarily do surgery and cut them open like surgeons do. And that's if you've got some intellectual curiosity, if you like problem solving, then medicine is for you. And lastly, this is quite important for to everyone. Pay. Does it pay well to be a doctor? Now, this is quite controversial. It depends on who you ask and in what country. But in certain countries you get paid much more as a doctor. But I'll use the UK system as a reference point. In the UK, after finishing medical school, you do your 2 years of foundation. When you start working as an FY1, the first foundation year, you get between £30,000 to £40,000 at the moment per year. And that goes up to around about 50,000 when you finish your foundation training and you go into core training. So here the structure is, if you do medicine, internal medicine like I did, you do 2 years of foundation training, 3 years of core medical training, and then 4 years of specialty training that you choose. So all in all, it's around 10 years. Once you get into core training, you make above 50,000 a year. And that, when you progress in your training, it goes up all the way to around 80,000 a year. And when you start as a consultant, at the moment, I believe the consultant salaries start from £93,000 a year. Now, there's a lot of controversy, and of course, doctors have been striking in the UK for the last year or so over pay disputes, because while that number might sound big, but doctors go through medical school and a wide range of other examinations and a long, over 10-year training that takes a lot of mental energy. So yeah, I mean, but all in all, I think doctors do get paid well enough to have a comfortable life. And you do get paid well above average. So with the job security and with the impact that you can have on your patients' lives, I think that if you're remotely interested in medicine, go for it. Thank you very much for watching this video, and don't forget to like and subscribe to the channel. Thank you.